My study is really looking at the outcomes associated with warfarin treatment, time in the therapeutic range among veterans with the NVAV in the United States, 2005 to 2015. Veterans is a very important study population for, we certainly need to provide a best care for our veterans, which it is a national priority. And then what we want to really look at is that whether now they have received a good treatment, if there are any gaps, how we can address those gaps. This is a retrospective cohort studies, really looking at the veterans with the NVAV, and also really looking at, they also have the NRR measures, and then on the warfarin treatment. So we have found a quite a significant proportion of patients have a poor warfarin treatment, which indicates a room for improvement. And I think that's the first key message we have. And compared with those have a good management, those individuals with a poor management has been indicate a high risk for the adverse clinical outcomes. We have using a called the Rosendale methods, which is really looking at how many times or how long they can stay on the therapeutic range over a certain research period. Obviously, it's evolving. We can see as younger as those that just returned from Afghanistan, but most of our patients are on average of 70 years old. So we're talking about the Korean War, maybe Vietnam War, and then I think we have very few people from the World War II. The result here is that obviously there's a lot of rooms for us to improve the warfarin treatment, which is also very cost-effective treatment. But there's such a substantial amount of populations really have not received a good treatment. So we need to find a innovative way to address that.